First, position the wheelchair parallel to the patient's bed, at about the shoulder of the patient. Next, lock both the wheels of the wheelchair. Next, remove the armrest close to the patient so it's not in the way during the transfer. While keeping good lumbar lordosis, make sure to turn the casters of the wheelchair forward to prevent movement during the transfer. Supine to sit. Since the patient is a young, healthy, and able individual, you can first instruct the patient into a long sit by telling them to get on their elbows and then to push up on their hands. Next, the patient can independently turn so that their legs, distal to the knees, are off the bed. Next, lower the patient's bed until both feet are touching the ground. If both feet still cannot flatly touch the ground, you can bring the patient forward until they do. Transfer from bed to wheelchair. With gait belt around the patient's iliac crest, the patient can hold onto your shoulders or waist, but not your neck. With your hands grasping the patient's gait belt, you can instruct the patient to lean forward with nose over toes and to stand up with a count both agreed upon. With patient standing, take small steps together towards the chair, putting more weight on the stronger leg, depending how much the partial weight-bearing leg can tolerate. Next, have the patient reach for the armrest with one of their arms, and while leaning forward, have them slowly lower themselves into the chair. While doing this, the therapist should maintain good posture and body mechanics by keeping their lumbar lordosis. Next, place the armrest back on the wheelchair and lock the leg rest into place while placing the patient's legs on them. Sit to stand. First, instruct the patient to come forward in the wheelchair, then to put the stronger leg further behind the weaker leg. The patient then holds both auxiliary crutches on the side of the weaker leg. The patient is then instructed to place hand of stronger side on the armrest for push-off. The therapist then positions themselves on the side of the weaker leg and grasps the gait belt with one hand, while the other is on the shoulder of the patient. On a count that is agreed upon by the patient and therapist, the patient leans forward with nose over toes and stands up, while the therapist grasps the gait belt in case of fall. The patient then transfers one of the auxiliary crutches to the other side. While standing, the crutches should be 2 inches laterally from the patient's foot and 4 to 6 inches in front of the patient's foot. While standing with crutches, there should be about a 3-finger space between the crutches and the auxiliary portion of the patient. Also, there should be about 20 to 25 degrees of elbow flexion. Also, the handpiece should be at the level of the wrist crease. Gait training. 3 1-point partial weight bearing gait pattern. For partial weight bearing, a 3 1-point gait pattern will be used. The patient is instructed that the assistive device and the partial weight bearing lower extremity advance simultaneously, then the full weight bearing lower extremity steps through the aids. The therapist should stand on the side of the weaker extremity with one hand grasping the gait belt and the other holding onto the patient's shoulder. Stand to sit. First, have patient go to wheelchair, then pivot around so the patient is facing away from the wheelchair. Have patient back up until legs touch the front of the wheelchair seat. Then have patient transfer both auxiliary crutches to the side of the partial weight-bearing lower extremity. Then patient grasps armrest with hand on the side of the full weight-bearing extremity. The patient then bends forward with nose over toes and then slowly lowers themselves into the wheelchair.